rationale and advantages of community mobilization. In this section, we are going to look at the reasons and advantages of community mobilization. Community mobilization refers to the process through which community members are engaged in the identification of their needs and issues, as well as in the planning and implementation of potential solutions. This approach is crucial for enhancing community participation and empowerment. One of the rationale is to create active community participation and involvement. Active community participation refers to the engagement and involvement of community members in decision-making process, resource management, and program implementation. This participation can take various forms, such as including in attending meetings. However, in our country, when immunization program, because it's believed to be community-based, when the planning start, we call it the micro-planning. The health worker along the village development committee come together with other relevant NGOs to draw the micro-plan. This allows the community to make an input. As such, create active community participation and involvement. So that's one of the reasons why community mobilization is used in community practice, to allow the community participate and get involved. Another reason is to create active community participation and involvement, like we said, so that they will be part and parcel. Another reason is to foster self-reliance and initiatives. Self-reliance is important for sustainability in community development activities. You can build a borehole for them. If they don't participate in the planning and the building, and they will allow it to get what's spoiled, and they will see that's government in that. Once government have built, the government will rebuild another one. But if they participate, they will see it as their own, and they will also make sure that it doesn't get dilapidated. Community mobilization empowers the community members to depend on their resources, skills, and initiative rather than relying solely on external assistance. Okay? Another example of community, how it leads to self-reliance is a community can be taught on how to manage some certain health issues, like in sharing of albendazole and on community gardens in order to enhance nutritional status in a particular community. As such, that fosters sense of ownership over health and well-being. Another rationale is to inform and educate the community on health matters. Education is fundamental in addressing health issues. It involves disseminating knowledge about health risk, preventive measures, and available resources that can lead to healthier choices and promote overall well-being. And how can this be achieved? Through workshops and seminars, you can improve the knowledge of resources. And as the people are getting closer, as they are getting interested to know how they can contribute, they tend to learn. As they are doing micro planning, they are learning which one is and how to enhance their own health. Another reason is to motivate the community to take an active role in the community. How this is achieved is by motivating them. Remember, community mobilization is there to encourage, inspire, and raise their interest. So when you celebrate what they have done collectively, you see that the community will be much interested. And before you know it, they are now taking active role in ensuring the community health in their community. Another rationale is to build this spirit in them that their problems are known and will be taken care of. When people feel that their issues are recognized and will be addressed, it cultivates hope and encourages participation. When you come and share the findings you have found, maybe during community diagnosis, and also tell them the plans you have, if they cooperate with you to improve it, the people will be happy and they will show interest. So therefore, community mobilization helps to build the spirit in them that, yes, our problems are known and will be taken care of. Another rationale is for them to accept their own health problem. Yes, because they are coming closer and they're now getting educated, and their literacy level, health literacy level, and health knowledge and health consciousness is increasing. They will come to understand, yes, this is our problem in this community. Let's find a way to solve it. As such, community mobilization help the community members to accept their own health problem. Now, let's look at another part of community mobilization known as functions of community mobilization. One, community mobilization helps to identify the community own's problem. Yes, through mobilization and the people getting involved, they will now say, this is our own problem. That our problem is malnutrition, our problem is mental illness, our problem is armed robbery, or our problem is vandalization, or our problem is lack of good water source. They will then, this is our problem. It could be a social problem, it could be a health problem. Second function is it identifies the resources available in the community. As the people are getting involved, everyone is interested. You will find out that in the community that they have people who are in the power politically, people who have the technicality in them. Let's say the problem of the community is to build pipe-borne water. Find out there are engineers in the community, or they have children abroad who can actually donate, and these things will be built. Another function is that it plans solutions to identified problems using the resources available in the community. Now we have identified the resources, we have engineers, we have people in the political. Now, they now begin to plan solutions. Okay, since we have somebody who's SSA to the governor, let him write to the governor to help us. Since we have children abroad, let them make contribution, let them and buy some certain equipment necessary. And since we have able-bodied youths, let them clear the bush where the water borehole will be built. So it helps to plan solutions to identify problems using the resources available in the community. Lastly, it fosters prompt attention to health needs and problems. Yes, because the community members now are aware that this is our problem and have accepted this as the problem, they will put everything within their own capacity to solve that problem. As such, it now fosters prompt attention to health needs and problems. Advantages of community mobilization. One, it increases community, individual, group capacity to identify and satisfy their needs. Yes, of course. Since the people are coming closer, they are now learning, their health literacy is improving, their health consciousness is improving. They now learn. They can now know how to prepare ORS on their own. They can now know how to manage some of their minor ailments. As such, their capacity of identification of problem, their capacity of decision making, their capacity of critical thinking, problem tree development will be improved. And they now say, okay, we can say, that our people suffer malaria within this time of the year. However, look at how we can prevent it. See, their ability, their critical thinking, decision making, and problem solving skills are improved. When communities come together, they can share knowledge. As they are coming together, engineer is coming to bring his knowledge, someone from the finance is coming, someone that is a market woman is coming, someone from the farm is coming. They bring knowledge together. As such, they become innovative and find what works for them. As such, that this helps and fosters problem-solving strategies for that particular community. And as such, builds resilience. Because as communities are coming to address their own needs, it's helping to build resilience. So in case anything happens, they can come together again and solve that problem. So as such, it helps to build resilience. So through resilience, they can stand strong against vulnerability. Another advantage is it enhances ownership of health programs by the community. Since the members of the community are aware of the program, they are part of the program from the planning, implementation. They now take the program as their own. They see that this is what we are doing for ourselves. So they don't demand much. In fact, they even put their own resources to ensure that that program is through their active participation, community members now involved in planning and implementation of health program, and they feel a sense of belonging and responsibility to the initiative, and you see them protecting it. And more also, since they are part in the planning, they will see that this is good to our culture. As such, they will not see it as community-driven projects that are for their own consumption. And they are now more likely, because they understand everything, to embrace it and support the program. It also empowers them. As they are feeling that ownership, it empowers these individuals and communities to advocate for their own needs. And as such, leads to better health outcome, and also strengthens the community ties and social cohesion. Everyone will be seeing each other as one. So that's very important. Sustainability. Programs that are owned by the community have higher likelihood of sustainability because communities are more committed to maintaining initiatives that they initiate and support. So through sustainability, empowerment, active participation, through sustainability, empowerment, and active participation of the community members in health programs, this enhances their ownership because they're already empowered because they have the skills to now detect, they have the skills to identify, they have the skills to contribute. They are empowered, they have the resources, they are actively participating. They now take ownership of the program. At times, you see them say that we want to take over our hospital. Maybe if the government is not doing it, say we want to take over our hospital. So community mobilization helps to enhance ownership of health programs by the community. So that is the importance of community mobilization. Another importance of advantages of community mobilization, is quality of the program is improved. Yes, because the people are involved and they are putting in their best. When communities are involved in the designing and implementation of the programs, the interventions are more likely to be tailored to that specific need, which improves the relevance and effectiveness of the program because they are now part and parcel of the program. It also enhances their feedback because mobilization typically includes establishing feedback mechanism, allowing the communities to provide input on the effectiveness of the programs, which leads to continuous improvement. So through feedback mechanism, it enhances the quality of the program. Through feedback mechanism, it enhances the qualities of the program. As such, the quality of the program is improved through feedback, through involvement, and through resource utilization. So the people will make sure that the resources that are acquired for that program are being used. And also, they leverage on the local knowledge they have. The resources are valuable, like we said earlier, to ensure that that program is both efficient and effective and of high quality. So through resource mobilization, leveraging on technologies, they also contribute to quality programs. Through innovation again, committee members often bring unique insight and innovation ideas that can enhance the quality of the program, which leads to a better outcome. So innovation also contributes to improve quality of the program. Another advantage is evaluation of programs is easier. Another advantage is that evaluation of programs is easier. Because the people are involved in the assessment. When people are involved in the assessment, they can actively participate in the evaluation process, and they provide insight and feedback on what works and what does not. This collaborative approach leads to a more accurate assessment of the program. Trust and transparency. Trust and transparency also enhances the evaluation of the program, because the people see that this is what we are doing for ourselves. So the need for fraud and all of them will not be there. So community facilitated evaluation often foster trust and transparency, as committee members are more likely to be forthcoming with feedbacks when they feel their voices and opinions matters. Dynamic evaluation process. With committee involvement and participation, evaluation process can be more adaptive and responsive, allowing for real-time adjustments to be made based on community feedback. So as far as the people are part, you see, they will be looking out for what works for them. And as such, they will give a quality evaluation. As such, the evaluation of the source of the program implementation, and outcome becomes much easier. Better results are achieved. Through community mobilization, better results are achieved. You know that since the people see the program as part and parcel, they will give it the best. And as such, quality and better results are achieved. Programs engaging the community tends to see higher participation rates. Yes, because if it is for immunization, they will tell their people to come out and take the vaccine. So therefore, community mobilization often facilitates a holistic understanding of health that goes beyond just medical solution. It also considers social determinants of health, which leads to a comprehensive intervention and that addresses multiple aspects of the well-being. Empower communities. Empowered communities are more likely to adapt and sustain health-promoting behaviors, which result in long-lasting benefits rather than temporary improvements. Increase resources. Mobilized community can leverage local, national, and even international resources, leading to more significant investment in their health outcomes. Another advantage is it improves the quality and soundness of the program. The involvement of the community in various phases of a program ensures that it is continuously monitored and the feedback is received promptly, which enhances the overall quality and effectiveness of that program. Build trust between health providers and community members, which leads to a better cooperation and communication and improving program efficiency. When a community is strengthened, their capacity is solid, they can assess their needs which allows for more effective resource allocation, ensuring that the intervention focus on priority areas for maximum impact. So these are the advantages of community mobilization and the rationale for community mobilization.